Hi, everyone. Today we're chatting with Eric DeJesus, co-founder and CEO of Annate Bitherapeutics out of Athens, Georgia. Eric, it's so great to see you. It's been a few months. How was your weekend, and did you do anything interesting?
Weekend was great. We actually were able to get up to the Smoky Mountains. Went up to the Pigeon Forge area to celebrate my mother-in-law's 66th birthday. She loves every year getting the family together. It was about 14 or 15 of us this year. And they rented a large cabin, and it was just a fun weekend filled with some hikes, the things to do on the Pigeon Forge area. And actually this time we had a chef come to the house and actually prepare one of the meals. That was a great experience. And we still managed to set off the smoke alarm, but it was great in the end.
That's awesome. I actually was in the mountains also
Really?
this weekend. My husband and I went just to the North Georgia mountains to a bison ranch, actually, to see a
Really?
concert and get some barbecue. And the ranch owner said that the bison is the only animal to actually face and go toward a storm. And that reminds me a lot of building hard, complicated things, especially in the state of Georgia.
Yeah.
So I would love for you to tell me and describe to me as if I were 5 years old. What does Innate do? What are you all about?
What we're doing at Innate is we are taking something that's already in your body that is acting as a protection against a bug, a parasite. And we're saying, hey, keep doing that, but also can you go against cancer and start attacking that as well, like it's a parasite?
Yeah, I've always thought of Innate, it really feels like something out of a movie. Uh, the science part's so interesting, right? But I think in this market, which the oncology market is crowded and investors seem to be making bets on more incremental improvements. Against that backdrop, why does Innate cut through the noise and how do
Sure.
you win?
So you if you're familiar to the audience members, if you're familiar with any real malignancy right now, you will understand CAR T, the bite therapy, antibody drug conjugates, ADCs, all of the wonderful approaches that are crowding the market to go towards a malignancy. They are really good for people who have, various diseases such as ours, which our first focus is multiple myeloma. And they make great headlines. The challenge is when it shows you 60 to 90% effectiveness, that's wonderful. When you dig into the numbers, however, you realize it's for about 2.5% of all patients. So while it's extremely effective, its therapeutic window is very, very narrow. They need something different, a complete different mechanism of action. And not to go granular, a different mechanism of action is what the majority of these fields need. And I'll say this to go slightly granular one step further, an immune cell independent mechanism that's not an antibody drug conjugate. When I say that phrase to somebody who's familiar with the field, they pause and they go, that doesn't exist. What is that? And I have the joy to share with them that there is something out there. And that's exactly what we're bringing to the clinic.
I mean, given the enthusiasm on your side and from people who actually know what you're building and the potential here, how do you manage the psychological weight of knowing that seeing any real commercial traction, psychological weight and investor pushback? Of
Sure.
seeing commercial traction, 10 years down the line, or yeah, I don't know the exact number here, but
Mhm.
in funding therapeutics, the playing field is very, very different from investing in software
Right.
or anything else, really. So how do you grapple with that, and what keeps you going?
Our entire existence has been in the gap. It's what builds resilience. And I've been told by half a dozen independent people, wow, Eric, the one feature of you and the team is you are just relentless. You can share a very complicated story in a unique way that we understand as the audience who may not be in cancer, but you are certainly relentless, and you have to be. I have a phrase that I tell my daughters, and it's a very simple phrase. It's my wife and I have decided it's the phrase of our house is we do hard things. We do hard things. My 11-year-old battles epilepsy, and she just gets so frustrated sometimes with trying to do the reading, trying to do the math, and just her brain has a difficult time focusing. And now I hear her go, but we do hard things and we just pick ourselves up and keep going and use the help around us, but we keep going. And the thought that we are completely protected from certain parasites because of this particle that we're using, that knowledge is what keeps my drive up of if we can protect against this 100%, why not over here? We just have to figure out the precise way to redirect it. Some good success so far.
Incredible. Well, there's a lot of threads to pull there. But at the top of your response, you mentioned your team. I would love to hear more about them, about the name behind Annate.
Yep.
I would love to hear more about your team.
Yes. Oh gosh. All right. I mean, I love Innate. I love everything about it. And it was born out of adversity. I came to the University of Georgia, 2009, on the heels of the financial crisis. I came there wanting to specifically work in cancer therapeutics. I successfully had a wonderful first year, rotated and joined a great lab. And then the funding fell through that first year. So I had to, in one day, pick myself up and pivot and find another place to go, either after I'd already been fully settled and had a project. So I go to just the head of the department to find it, get in there, and he starts telling me, oh, yes, you can do the things that you're interested in my model system. I was like, I didn't know you work on cancer. And he said, no, I work on African trypanosomes. Okay, I don't understand that link so far, but he goes on to tell me about the particle that kills them. And I immediately think, that sounds like a drug. That sounds just like a drug. So I say, why doesn't it kill us? And at first he actually thought I was talking about the parasite. And then when I clarified, no, why doesn't that thing kill us? And can we make it kill us? That's where this all started. That was 2010. I did the first series of experiments from 2012 to 2014. And then we had to push pause because Steve's wife, co-founder is Dr. Stephen Haydick, his wife, Anne, came down with multiple myeloma. And as you can, imagine without much stretch of your imagination, working on a cancer therapeutic academic project while your spouse is actively going through treatment around the Southeast United States, it wasn't a good combination. So we hit pause. We hit pause on it while they just focused on that. And I stayed in the area, did a postdoc, and we just waited for the right time. And I knew it might not come back, but I just wanted him along with me so we could go at this together. And, unfortunately, Anne lost her battle in summer of 2019, and we picked right back up in January of 2020. Turned out that the timing was a bit challenging with COVID, but that's when we picked back up. And this particle that we focus on is part of the human innate immune system, INNATE. But to honor Anne, we decided to name it Innate. So that's where the name comes from. And Steve and I have been with this since day one, and we've been very fortunate to have who was a postdoc in the lab at the time when we started this back up in 2020, Dr. Michael Cipriano, He's joined us. So it's the three co-founders of Innate, and this is just a pure passion project that we want to see all the way through the clinic.
I see you as something so special. When I look at you and when I have a conversation with you, and when I see how you're executing on your commercial milestones and planning for all of that, planning for fundraising, et cetera, you're so different from so many of the researchers that I talk to. How are you able to wear both hats so seamlessly and like switch between, all right, science to, all right, potential partnership to potential investor? How are you able to do that? Act as if you're sort of talking to someone else who's a
Right.
researcher with a startup.
Mm, that's a God, that's a good question. Because it's not something that happened when I started Innate. I always said yes to opportunities, and then I'd figure out how to actually make it work later. And I and I always thought, oh gosh, I don't really have time for that. Time's there. It's just you weren't efficient with it in that previous season, and you thought you were busy. You were just you just weren't using your time that well. I have so many interests. If I also know I will not be the master at any single interests like my hobbies. Um, I will master being a wonderful dad and husband, and I will master figuring out how to get Annate Therapeutics to the clinic. Those are my goals. I have other responsibilities in life and I will always tend to them, but that has been what I would say, like you to another researcher at Georgia, because I've had a few, hey, I'm a PI of a lab and I have an idea. Is it really hard? Actually, yeah, it's really hard to get a translated idea out of a lab because there's so much to do.
Yeah. Yeah, I was curious. I figured that had more to do with your upbringing and who you are as an individual rather than just something you flex on and off. But you also touched on translating science, translating this IP and actually getting it out to market. And this is something that you and I talk about a lot. When you're talking about your team composition, I think of other IP backed, researchy companies. And a lot of the time I see three different profiles, right? So I'll get like the fully researcher entrepreneur who's really just dipping their toes into business and communicating with people outside of the lab again. Other times I see fractional leadership sort of put in place, just smack them on top of a company and saying, here, you go do it.
Right.
Totally the wrong approach. And similar to that, and something that I just experienced last week with another one of our Georgia Research Institution spinouts, was you had this really great IP, and then they coupled that, they slapped on an undergrad who was sort of like, bull in a china shop running things like it were a SaaS startup in their dorm room. And none of those scenarios are correct, right?
Yeah.
What you're doing right now, it requires such an extreme amount of precision. And I think that's
Right.
what I'm looking for. I think the profile of a founder spinning out or commercializing a therapeutic, that psychological profile is very, very different from these more vibey SaaS companies that we're so used to seeing. This is way more capex intensive.
Mhm.
It's often left behind regulatory requirements and require seasoned leadership for sure, but also you're deeply attached to the mission. And also you're
Yes.
pragmatic. And I love the word that you use to describe yourself and the team, tenacious.
Mhm. Absolutely. Michael, Steve, and I have actually been very fortunate enough to just go through our first real rounds of interviews hiring our first employee. Um, and we realized we work really, really well together. And Michael and Steve together, I think they've met 2002, and I met Steve in 2009. We've had years to just understand each other and build. And I'm not saying that a team that just met 6 months ago can't do it. No, I'm not saying that at all. I'm just saying we have learned our strengths and our weaknesses, and we are now actively moving while acknowledging them and working with them, right? So it's been such a dynamic push and pull that, of course, early on, there was a couple of, tense moments where we're just trying to figure out who's going to do what. And I'll be honest, I had some insecurity and hesitation the very first time because Steve was my PI in grad school. And I'm thinking, okay, well, Steve's just going to lead this. Meanwhile, Steve was like, Eric, this was your idea. I said, go for it. Go for it. You have what it takes, but I didn't feel like I had what it takes because I just saw the PI and you should just, isn't that what you do? That we, several conversations of just, hey man, you've got this. You have what it takes. Because God, I feel like that's the number one question we ask is, do I have what it takes? Yeah, you do. But it takes effort and failure. Oh my goodness, the number of failures that we've had over the years, whether it be actual experimental data or presentations, practice talks, pitches. It's relentless. You just got to be relentless I come back to that. So do whatever it takes to get it there. That's the goal. If I had a doubt in the science, I don't think I'd have the composure to do it. And we have been very fortunate with our team and the extended team. That is not the founders, but our wonderful collaborators and board members at Winship Cancer Institute of Emory. There's members at UAB Medical School, down at Augusta University with wonderful, even NIH. We've had fantastic collaborators over the years speaking wisdom, both scientifically and strategic business world into, hey, this direction and not that direction because of ABC, right? That it's the team. We have a brilliant idea scientifically, but without the team and the tenacity, it's not going anywhere. So I'm very fortunate. God, I'm fortunate.
Absolutely. Team is crucial. It's crucial. It's something as an investor of things that are, again, IP backed more often than not, almost exclusively. I think investors also interested in things that are IP backed tend to forget how important team still is. Like we're still looking for entrepreneurs who know how to stick with things and know how to execute properly. And, I still go back to you actually having a personality, actually being able to have a conversation with me. That
Yeah.
is so special in this space. You have no idea how much you stick out like a sore thumb, but in a good way here. So
I,
that's
I,
that's why that's why I'm talking to you. It's very, very hard to have conversations that people would actually want to listen to. And you think about how that translates into, again, investor relationships, but
Mhm.
also you work on policy. You've been up to DC and I believe our state capitals talking to stakeholders that are making these huge decisions on
Right.
not just the future of Innate, but other therapeutics too in this whole country. You have the ability to do that. And do you want to add anything there before
I
we move
do.
on?
So that
Okay.
was, so that's, again, it goes back to say yes, because one of my biggest goals is to identify blind spots. Because I have to wear so many hats, that means I'm going to put a hat on that doesn't fit that well, and I need to make it work. So where are my gaps? Where are my blind spots? And you say yes to opportunities, you're going to find them. They're going to come out. That's what DC and our state capital were opportunities to go meet senators and representatives, talk about Innate, but talk about the state of biotech in the state of Georgia. I'm trying to do a biotech at an ag school in the state of Georgia. Okay. That's called an uphill battle from the start. And I love UGA and the team that we're surrounded by. But we're not known for biotech and building therapeutics. There's a wonderful department of therapeutics and pharmaceutical studies and biochemistry. God, I love our department, but it's an ag school that has obviously football and intense studies and lots of IP around agricultural plants, grasses, all of those. So they have that IP knowledge without a doubt. They're solid on that. It's just you got to build the right team within that infrastructure, and we're all learning. That experience of going up to DC and meeting with real regulators and sharing the story of Innate and why we wanted them to have biotech as a word at the front of their language that's next year is to understand, hey, this is the number one income per individual in the state of Georgia. We want to bring more to the state of Georgia. And not every single job has to have a high degree associated with it. Johnson Johnson just broke ground in Athens, and it's going to be a position where PhDs, you don't have to have a PhD to be there, which is wonderful. You can bring these jobs in. And I just wanted to take advantage of that opportunity. And it turned out I was the only company being represented by the state of Georgia that day to I think both senators and I think 6 representatives, and got FaceTime with almost everybody. Same in the state capitol, where I've now had lunch with several representatives since then, just to share the story. And that's you don't, if you don't say yes, you don't get those opportunities. You don't get that experience to just get that incrementally better at sharing what you're doing and why, and always refining the why. God, I love this stuff.
I love it too. I love it too. I think a lot of people in Georgia don't realize. I mean, UGA is absolutely, I think we all know, more of an ag school than not.
Mhm. Correct.
The state of Georgia is also an ag state. It's
Yes.
very, very difficult to do anything different here. It's not difficult to start a business, but to actually scale a business and have that more infrastructural support,
Right.
it's difficult. So thank you for your work there. Now you gave some shout outs to a few different institutions, and we love you at Georgia Life Sciences, and
That's right.
you've got a lot of people in the state that love you. But I'm curious if you had to sort of name the hardest part about building your company in Athens, Georgia. What would that be?
We have unique challenges in and of our own, where we are coming from a parasitology lab over to cancer. That's a mountain that we knew would be tough to climb. Admittedly, didn't think it'd be this hard, but here we are. We have now had to learn how to communicate even more clearly. And quite honestly, post-COVID, it's really quite shrunk. I pitched to companies, VCs rather, all over the country and the world. So that's not really anything that stops us. I think the only thing that I can, without living it out, I can say we're deficient to is the natural and organic mixers in Boston and in San Francisco and in Austin Tech Hub, even DC, New York, and Chicago, because we've talked to companies there, not having that natural, oh, I'm going to meet some people at a mixer because it's put on by an event, some sponsor, and there's 6 VCs there that you just start talking to, and you don't even know they're VCs until after. And I can just talk because I love talking, and they're like, wow, like naturally what I've done is, oh, people want to learn more because we just met. There's not that opportunity in Athens. There's some in Atlanta, and we certainly say yes to everything and go to as much as we can. But again, it's not the dense hubs.
Yeah, absolutely. That's really good to know. I mean, I'm always wondering where I can sort of tap in and push things forward to create more opportunity in the ecosystem. But I would say I think that we're starved of private capital here. It's a little bit of a chicken and the egg situation too, because we have wonderful research in the state of Georgia, but we don't necessarily have lots of research that's ready to be invested in. So I think, without that investor presence, there's no real incentive for capital readiness, right?
Yep.
But the investors won't come until the startups are ripe for the picking.
I want to speak to that, what you just said. And I will highlight, I'll be a little advertisement for GRA, Georgia Research Alliance. The team over there, and I in particular work with Justin Burns. They have rebuilt the mechanism of which they fund companies that have IP anchored to the university system in the state of Georgia. Before they funded our pilot studies years ago, I think it was maybe 22 to 24. And they were small pilot grants of $25,000 at a time. Okay. And you build small studies, but anyone in therapeutics starts to laugh when you hear that number, because what in the world are you going to do with that? Well, at least in that era, it's enough to buy a novel antibody. It's enough to get a cell line. And if you're working for volunteering your time to get some preliminary data done, we ended up going with just 75,000. So 3 rounds of that. And it was enough that has just now unlocked another over 900,000. So, and GRA stepped up again because of that very gap that you referred to as, chicken and the egg. How's it going to work? And I can just say with, absolute pride that they stepped up with another 250,000 to say, okay, you know what? That pilot study worked. You went out there, you pitched it, and they said, that's extremely novel. Come back with a little bit more. So they said, we're going to step up at GRA and we're going to write a check for 250 after you already said, this is what we could do. And then we vetted it. I'll hand it to that team. It was incredible. Justin and Andrew really pushed us and said, okay, you've written a series of experiments that would get investors to jump into the conversation. Now go pressure test it. So we went out between the state of Georgia, Alabama, and reached down into, I believe, Florida. I think some of the collaborators were there to just say, okay, this is what we're going to do. If you were handed this data package at the end of it, what would you sit there and go, oh, I really wish I would have seen that. Wish you would have done this. And I don't know why you did it that way. What you should have done was, XYZ. So we spent another month pressure testing and came back and said, what we really are going to do is this. And they said, okay, we'll fund the whole thing. And very fortunate, that same pilot data was able to fund another $250,000 from the International Myeloma Society, which is another non-dilutive grant, and a derivation of that same pilot data from GRA of 75,000 and our time and effort over 2 years. Just released, well, it's not been officially announced, but it's everything but an SBIR grant. So that is absolutely critical in helping us, all non-dilutive, not a single diluted dollar coming into this. And that's going to absolutely change the game for us and our trajectory. And it's because GRA, the state, took a leap after we, said, hey, we have this idea in the lab. We want to try and launch it. But they have pivoted and said they're writing bigger checks now, obviously, than 25,000. So for the state, innovators at the university, it's there. The opportunities are growing. So I didn't want to let that moment pass. I wanted to, kudos to them for that.
Yeah. So huge shout out to GRA. Thank you for everything that you're doing. Also, you mentioned stacking capital, front loading with non-dilutive capital. That's so important for companies like yours, isn't it?
Yes. It is. Of course, it could be done in other mechanisms. At therapeutics, you don't go out and get loans because It's therapeutics. You don't get loans until much later in the game. We're still in the phase of just de-risking concepts, right? Um, and we went out in the spring, and I think I reached out to 160 different venture groups and family offices, and just on my own, and just pushed. And I got some contacts through friends in San Francisco and some contacts through friends in Boston. Said, let's build that list, and that list took, you know, a while to build. So it wasn't absolutely cold calls, but, you know, out of those who did respond, which is about the accepted, probably 10%, that's what you realistically get. And you hold those calls, everybody loved it. A lot of people had some reservations about the indication, because, it's a crowded space. But by the time we had the chance to explain, yes, you're seeing all the headlines for 2.5% of the patients. Okay. Then you say, okay, well, I do understand that. So it's framing the story. You have to understand how to frame that story. You're not being dishonest. You're just pulling back the curtain and saying, look beyond the headlines. Other indications that we're working on, like pancreatic cancer, there's not any pushback on that. It's like, well, yeah, that's a terrible malignancy. But as soon as you have data on that, let's see it. We're just working in a world post 2022 where you're not going to have people falling over themselves to fund you with just in vitro preclinical. Of course, you should have never have done that, but people did. That's fine. The new world is show the in vitro, show the ex vivo, show the extensive animal studies. And that's what we're now able to do. We're so excited and so fortunate. It is not lost on us, the opportunity that's in front of us. And now we're just trying to capitalize and make the best decisions you can with the information you have at the time. So get the wisdom of counselors around you. And you're one of them. So, so thank you.
And anything you need, truly, like you're such a pleasure. And I really believe in you, and the rest of the team. As you gear up for a formal fundraise later on down the line,
Yes.
um,
Yes.
what do your investors need to have? Like, what would be value add in terms of partnerships, in terms of, relationships that you could tap into? What would your like golden ideal investor have and be able to offer you?
I think that outside of just the pure capital, it's going to be the experience and the connections to individuals or teams who have done it. So it's not that we're asking them to directly do a process for us. It's to evaluate a process we have put together and to see, is this the best it could be? Because again, we understand the science will be difficult. So let's not make every other front-facing thing difficult. Let's make smart decisions where you can make smart, because this is already going to be hard, right? Work smart versus work hard. So that's what features I think we would value. Gosh, I dare say just as much as the capital itself, because that's a different type of capital. But if it saves you, the only example that comes up to top of mind is tox studies. And there is a growing data set that shows that there's a way around tox studies if the animals you have to test it in for GMP just don't have your target and don't have that thing that you're going after. Well, that right there saves you on average 10 months and $1.5 million. So if I can have an investor that has a contact that has experience with, evaluating those types of situations, that's a hard and concrete example of what you're saving with having members of a team with that experience.
So Eric, what are you all working on right now? What's next for Annate?
So right now we are in a very fortunate situation that with the grants that and the funding that has come in, we have to reevaluate the best case scenario. You wrote for all these grants. Congratulations, you got them all. Now what? What are your new milestones and how much closer to IND readiness can you get? And that has been an internal conversation since April, when the grants started to roll in. Uh, we have just yesterday put in for orders to do the first and most comprehensive round of optimization and humanization of our lead candidate for multiple myeloma. So we're very excited about that, because when that is completed and evaluated, that is the candidate that will go into GMP. So that will be the one that goes into humans in clinical trials and in our GMP toxicity studies. So we're very, very deeply excited about that, because that is the maturation of our lead asset. It's taken years to get there, but we're there. We submitted and it's processed as of yesterday. So that is all told, going to take basically the rest of this year to get that ironed out. Uh, We're very excited that once we have that in hand, we will begin a very thorough round of evaluation, both in our lab and with different um, animal study groups around the nation, both in San Francisco and in Boston, who will be evaluating that lead candidate in multiple animal trials, uh, which we call pre-GLP efficacy studies, as well as some pre-GLP tox and PK. So we're just, it's like we finally got there, and we're just so excited about that. And that has been able to afford us the opportunity to bring a postdoc on board. Um, and they will be beginning, I believe, around October is when we're going to onboard them. And then it's an additional set of hands with a brilliant mind that we can bring into the state of Georgia. They will be coming from out of state, from a wonderful lab. And we're excited to have them on board and grow and see where we go. And at the end of this, we will have um, enough data to say, okay, this is the package. The next step is just IND, do those studies, and go into the clinic. And boy, that's easy to say. That's really easy just to say. But there's still a significant amount of work left to do. We know that we'll have days of failed experiments and questionable data, or maybe, we've got to pivot. We got to try new things. But I can also share that on our pancreatic side. So a lot of our work is focused towards multiple myeloma. All the grants are focused towards multiple myeloma. But we actually have an animal study that's underway. We will start August 3rd, a challenge study on against pancreatic cancer, which we're very, very excited about. That's with our collaborators at the Winship Cancer Institute, Memory. And then we go from there. We start writing more grants and pitching that data, because a lot of people are very excited about the potential to have a good impact on that very terrible disease. So a lot of things going on right now. And yes, you did a great job reminding me I need to get those updates out. So thank you for that. I will be working on it this week. So anybody who's interested in understanding something that in the cancer world, it's a new cancer field. The idea of taking parasitology and pivoting it to cancer. It's not been done before. And there's the science is beautiful. It's just beautiful and elegant science. And we'd love anybody to take just a few minutes, look at our website, innatebitherapeutics.com, and understand and start to learn. And please reach out. We love to talk about what we are very fortunate and able to do here. So thank you so much.
And really promoting things. I'm just kidding. Um, well, thank you for that. So a few things here. First off, congrats on the postdoc. I bet it would be such a blast to work with you and you in mentorship and guiding and stuff like that. I bet you're a stellar leader. And Eric, I've had
Yes,
such a blast catching up with you. Thank you for chatting with me and recording it.
I
I
love
want
it.
to leave with something fun and ask you, what's your favorite movie?
Rudy.
Rudy.
So yeah, Rudy, the story of Rudy Ritter going to fighting through and going to Notre Dame. My my uncle was the dean of physics at Notre Dame for he was a professor there for I think almost 45 years and was the dean of physics. My sister went there. But when we first saw that movie, guess what? It's a story of somebody who was constantly told he couldn't. And you just have to be relentless and focused, and you'll get there. It will be hard. You will bleed. You will be told no. You will fail most of the time, but you will get there. So ever since that came out, it's been number one to me.
It looks good. I've not seen it, but you've inspired me to give it a go.
My goodness, Emily.
So so many movies I haven't seen. I, like you, am interested in so many things, and
I know.
sitting
Yeah.
still
Yep.
it can be a challenge at times. But it's on my list. It's on my list. I the older I get, the more I do want to sit still and just sort of like
Yeah.
watch something.
Sit on your hands, and I
It's
will watch this
happening.
movie.
Yeah. All right, Eric. Thank you again so much.
Awesome. I appreciate it. Thank you for the time.